Welcome to the program. I'm your host, Neal Howard. Thank you for joining us here today. Our guest is Dr. Mark Stephan. He's Vice President and Medical Director for Equality Health located in Arizona. He's joining us here to talk about next-generation technical capabilities that are finally making healthcare data operational. Welcome to the program, Dr. Mark Stephan. Thank you for joining us.
Thank you for having me.
Great. So a bit of background about yourself. What exactly is your area of expertise?
Well, I'm a family doctor by trade, so I practiced primary care for 19 years, principally with underserved populations.
And how long have you been medical director at Equality Health? Okay.
I've been here for exactly 1 year, and the company's just 2 years old.
I understand that there's a push, a sense of urgency, a newfound sense of urgency to practice preventative care. Isn't that what you guys were practicing, all along, or is there a difference now?
Well, everyone's been trying to do it all along. The challenge is that the quality just hasn't improved at the pace that everyone is hopes it would and expects it to. There's still a lot of work to be done to actually move the needle, if you will.
So what type of issues are we talking about when it comes to the quality? Are we talking about just too many patients and too few doctors? Too little education or awareness? What do you think the culprit is?
Well, it's probably a little bit of all of the above, but in my opinion, the greatest barrier is actually actionable information at the point of care for providers to actually know who's due, who do they need to outreach to, and anyone for that matter in terms of outreach and engaging individuals in getting these tests and so forth done. It's a big challenge, and all too often people don't have timely information at their fingertips.
So basically, it's physicians who want to give quality care, but they don't know where to give this quality care. They need to find out who needs the quality care. And as you say, you're serving mostly underserved populations. Is that what we're talking about? Simply knowing where to administer the care?
Well, it's the greatest irony, isn't it? We're in the 21st century, and physicians have electronic health records, and yet the promise of this era has not been fulfilled. Physicians still struggle to know who's due for certain tests, when they last had them. Ironically, the country's rich in data, especially healthcare data, and yet everyone acts like hoarders when it comes to that information. And so part of it is lack of sharing. Part of it is lag. Many times, the most people have available to them are claims data, which lags 6 to 9 months in actually getting to the provider. And if I could just go back for a moment,
yes.
Every physician is working on largely working in a fee-for-service type of payment arrangement, meaning that my focus day to day is seeing the patients that come through the door. And I don't really have the population health tools that I need to know who should I be proactively calling up, who should I be proactively bringing back to the office to get these tests and these certain types of care done. I'm still living in this one at a time type of workday. And what I really need are better tools and more up-to-date information so that I can be proactive. So at the end of the day, for example, I could prepare for tomorrow and say, here's all the work that needs to be done. Or I could take a little bit of time every week and on a population level, look at my flock, so to speak, and say, who are the ones who've strayed and who do I need to get back in to get certain care or certain types of services?
Does the name of your startup company suggest getting everyone kind of on an equal level when it comes to data?
Oh, certainly. There's a couple of components to this conversation. One is equality health. We're really focused on ethnic minority populations because we know that the disparities in care are significant, right? Whether you're Hispanic, African American, or other populations, we know that insured or not, there's a lot of people who aren't being reached, and that's really the crux of our company. But we have a software tool, the HealthBI company, that really provides this link that's needed between payers and provider groups to get this work done. I mean, there's more than, if you want to close the chasm in care between an ethnic minority and the rest of the population, part of it's just awareness and better intention. But there's also a key component of technology, which is tracking and demonstrating and showing me in real time the work that's been done and the work that needs to be done. In other words, if I'm a physician and I have my own independent practice and I'm relying on claims history from an insurance company to tell me, well, this was done or this was not done, it's not up-to-date information, and the story's not complete for all these quality measures that I'm now responsible for. And so I really need better information out of my own electronic medical record, and I need more up-to-date information from health information exchanges, from hospitals, from laboratories, from other sources. And so when I have a software tool like we have, all of a sudden I can say, well, I know as of last week or of yesterday, your blood pressure is controlled or it's not controlled. That's a common quality metric. I know if your diabetes is controlled or not controlled, and I can take action now or direct my staff to take action, and I'm not working off of a data story that is at least 6 months old. And that's exciting.
What about the potential to cherry pick someone in these underserved populations? I mean, we're already talking about them being underserved. Is there the potential for even further underservice?
Well, sure, that's possible. I'll tell you our experience, though, is when we cobble together networks of independent doctors, we're finding many, many practices that are already serving these populations. They work in urban and rural areas, and they're already there. They're already dedicated to this type of service, but they've been left behind in terms of technology. They haven't joined a large medical group. They don't work for a hospital system. They want to remain independent, and so they need to tie their raft to something bigger so that they can have the tools and resources they need to actually take care of the patients that are already have relationships with these groups.
Now, this is the HealthBI CareEmpower platform. Is that correct?
That's right. CareEmpower is the latest version, right?
Compatible across all operating systems. And does it easily transition into a company's or a hospital healthcare facility's existing analytical platform?
It does, because it doesn't replace your documenting tool. Mm-hmm. It's not meant to replace the electronic health record. In fact, what we do is we actually take the important actionable information out of an electronic health record, and then you tie it together with claims data, you tie it with imaging data, you tie it with lab data, you tie it with hospital information, so that in the practice, the physician now has a rich picture of not only what's going on, but it's broken down into bite-sized pieces, if you will, in terms of workflows. These are the things that I need to do for my patients so that I improve quality and better control their disease state.
Briefly talk about not only efficiency, but return on investment, the cost effectiveness of this platform, and tell our listeners where we can go and get more information.
Well, the cost effectiveness really comes in the current trend in healthcare is moving towards value-based agreements for the providers. So we're incrementally moving back to taking on risk, meaning taking financial responsibility for the health outcomes and the cost of care for populations. And as we do that, and I say we, meaning whether you're physician groups coming together, whether you're hospital systems, or whether you're payers, having tools like this actually connects all these different groups together, because we're all striving for the same thing. It's a national discussion now that quality needs to improve and cost needs to come down, and that's where the real return on investment is at the end of the year. is looking back and saying we can now measure exactly, and we know month to month, our quality is improving and we're controlling our cost. And that's exciting.
More information can be found at healthbi.com. Well, thank you, Dr. Stephan. It's been a pleasure, and I'm hoping you'll come back and talk to us again in the future.
Thanks for having me.
Right. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in, and download at SoundCloud. Be sure and follow us on Facebook and Twitter, and visit our affiliates page at hpr.fm.